So I'm Dr. Heidi McAlpine. I'm a neurosurgery trainee at the Royal Melbourne Hospital, and I'm a PhD candidate and researcher at the Florey Institute of Neuroscience and Mental Health. I'm doing a PhD at the moment, so I've actually pressed pause on my surgical training to pursue a basic sciences PhD in brain cancer and have a few babies. So I think one of the really awful things about brain cancer is that even if you have the best surgeon and the best oncologist and the best care, brain cancers are pretty devastating. They really destroy people's lives and they're universally fatal. I think what really excites me about the Brain Cancer Centre is it's not just funding research or a research project. It's funding a network of researchers who come together from lots of walks of life. We've got career medical professionals, oncologists, surgeons, pathologists, and then you've got career scientists, and then everyone in between, like myself, which leads to things that can't be predicted. So, I've sat in multidisciplinary meetings where, I'm absolutely sure what's going to happen with a certain patient. And there's someone there from radiology or, a radiation oncologist who has, this excellent idea about maybe a treatment paradigm for a patient that we hadn't considered. And I think it feels to me like the Brain Cancer Centre is the multidisciplinary meeting of research. What excites me about my research is it's different. It represents a whole new arm of brain cancer research, where we have been following leads with regards to proteins, genomics, immunotherapy, all which are becoming advanced and are excellent avenues to pursue. What my research is taking into account something that I don't think has been really taken into account before. The solid organ tumours like breast cancer or liver cancer, they're born in those normal solid organs, whereas the brain is an electrical network. So what we haven't been taking into account is that these tumours arise in a completely different way to any other tumours in the body. So pretty exciting new research has shown that brain cancer is actually an electrically active tissue. Normal brain cells or neurons are communicating directly with brain cancer cells, and it appears as though those connections are causing the brain cancer to grow, develop and spread. I'm trying to show this in real human tissue. Because of our patients giving up their own tissue at operation, I'm able to take a specimen of the tumour, which would otherwise be wasted, and record from real neurons and real brain cancer cells that are still alive from the operation that I've just taken them from, looking to establish show what has been shown, that brain cancer is electrically active, and more excitingly, it grows and it spreads because of neuronal activation. Keeping, how do I explain this? Brain cells are little and they've got really long tentacles that come off them. And to keep the cell alive, you need to keep everything intact because the hard part's keeping it alive. And then I take it, do some fancy slicing, and then the bit that you're saying, why can't you do this in an operating theatre, is I get these pipettes, which they look like a needle, I suppose, but instead of a needle would be like a millimetre across. So it's about, I think it's like a millionth of the size of a pinhead or something, like a teeny, tiny little end of a glass pipette. A human movement would move it too much. It's all attached to machines. And I drive this under vision into the brain slice and find one of these cells and kind of try and puncture it without killing it. And then listen to the electrical activity of it. But it's really hard to get to that point. I think it's just such a wonderful team. The Brain Cancer Centre is just bringing together wonderful professionals, both clinical and scientific, and I think that's really what's going to make a difference in the future for our brain cancer patients. So I hope for patients in the future that we have good treatments that make brain cancer a chronic disease rather than the awful disease that we see today. And I guess my personal long-term goal would be to put myself out of a job.